according to the recent study, approximately 50% of patients in age group of adulthood are suffering from hypertension. And a lot of these patients, despite taking medicines, continue to have uncontrolled blood pressure. Blood pressure is a silent killer and leads to deaths because of stroke, myocardial infarction. Today, we have Ajay Kirtane with us, who's professor of medicine at New York Columbia Hospital. So Ajay, welcome to our show.
Thanks for having me. Really a pleasure.
So Ajay, could you tell us what's resistant hypertension? How do you diagnose it?
Well, I think first, what you said is absolutely correct. There are millions of patients around the world with uncontrolled blood pressure over the course of time who have really bad events happen to them. And so there are many medicines that can treat blood pressure. There's exercise and lifestyle modification, eating less salt. And despite the fact that these are easy to do, unfortunately, they don't get implemented very frequently. And so as a result, blood pressure remains uncontrolled and people have heart attacks, they have strokes, and they die. As a result of this, we need better therapies to treat it. And so the first and foremost thing to do is to familiarize yourself with what therapies are effective and to talk to your patients. It's not easy when you don't have symptoms from a disease to treat it. Patients say, why do I have to take this medicine? I feel fine. But yet we need to emphasize it's important to take the medicine so that then they can prevent these events from happening.
So is there a cure for this? Can we have something which can permanently take away drugs or reduce drugs?
There's no cure per se, but there are new technologies that are out there. And you'd asked what resistant hypertension is, and what that typically means is that you've tried medicines, you've tried lifestyle modification, and yet the blood pressure still remains elevated. If that happens, patients want a solution, and physicians, you want a solution as well. You have to make sure you really tried, but if you don't can control blood pressure despite those efforts, there's a new technology available called renal denervation, and that technology aims to treat blood pressure without the use of a medication or without the use of lifestyle modification. You still will need those things, but the treatment is independent of that because it's done with a minimally invasive procedure.
So how does this therapy work and what are the complications with it?
So it's a great question, and everybody wants to know, why should I have a procedure with not knowing these issues? And so the way it works is that for most patients with elevated blood pressure, the nerves that are around the kidney are overactive. So they're signaling too much. And some medications aim to reduce that signaling as well. But what the procedure does, the procedure aims to zap those nerves and to reduce the signaling from those nerves. Because they're overactive, if you can reduce the signaling, they can achieve normal levels of activity and therefore reduce blood pressure. And the idea behind this is that with a procedure, and you can do this, then that is a durable effect. It's an effect that can be additive to that of medications and lifestyle modification. So it's just another tool that we have at our disposal to treat elevated blood pressure.
And does this effect last? Means the patient, once you have this treatment, do we expect that this treatment is going to be effective for years or?
We hope so. Right now, the data is out to 9 and 10 years at this very meeting, India Live. Yesterday, Felix Mahfoud, who's an expert in this, showed some series of data that had gone up to 9 and 10 years and show that it's durable. But remember, it doesn't work in every single patient. It works about 2 out of 3 times. About 1 out of 3 times it does not work. And we do think the effect is durable in those in whom it works, but we do need to study this a little bit more.
So this is invasive. So does it have any complications?
Just like any catheterization procedure, there can be bleeding effects, there can be vascular complications, but in general, it's very well tolerated. There does not appear to be a decrease in kidney function over time. And in fact, you would hope, although it's not been proven yet, that by controlling blood pressure well, you would reduce the incidence of adverse events like heart attack, stroke, and even perhaps mortality. But you need a lot of patients to study to show that.
Thank you so much, Ajay. This was great. It's a pleasure having you here.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.